Hi, welcome to HmongTherapy.com. My name is Yua Laura and this is Chu Lee. Today we'll be introducing the topic of therapy, what it is, and how it plays into the Hmong culture today. So Chu, would you like to start us off with what therapy is?
Okay. So the therapy that you and I are going to be talking about in our channel here is related to mental health. Okay.
So what is mental health, Chu?
Mental health is not anything physical, but it's pretty much like your mind and your emotions, how things affect your well-being. So it's not, again, it's mental, it's not physical. Just want to make that clear. So we're talking about emotions, feelings, relationships too.
Stress,
stress,
ability to cope.
Yeah, things like that. Anything that affects your mental status is what the type of therapy we're going to be talking about. Okay, so if you can't function because you have too much stuff on your mind, that's mental health. For example, if you had a loved one that passed away and you're having a hard time dealing with that loss, that's mental health. Okay. Now, if you break your arm and then you can't do anything with it, that's physical therapy involved, and then dealing with the whole how do I live with my injured arm or severed arm if it's that case. That'll be mental health then, so it impacts your thinking.
That's a great transition, because then I'm going to ask you then go back to what is therapy. Because therapy then commonly is understood as a process to help restore or to resort back to the previous state of being. So like if you had a broken arm, it would be to help you so that your arms would work again, or so that your arms would be able to be useful to you again. So restore back to the state of what it used to be. So in mental health then, Chu, what is therapy?
So therapy is, a place for you to go to talk to somebody to help you figure out how to function better again. Like for example, we use the whole arm thing. How can we, before your arm got broken and the way you looked at life, let's assume that it was joyful and life was good. But after that incident where you broke your arm, you look at life differently. So therapy is about mentally and emotionally, how can we bring you back to that state pre, your incident, before your accident with your arm. So therapy is about really helping you learn how to fix your problems, or learn how to stabilize your thinking and move forward in life and not be stuck. Does that make sense? You want to add anything to that?
I think also another thing about that is it also is an opportunity for change. So like if things were already good, but you wanted them to be different or better somehow, therapy would be a good place to talk about that, what your options are, and possibly where to go from there.
That's right. So, therapy is about change too. I mean, you said, if things are going good right now and you want things to be different, assuming that you want it to be better, how can we work on that to make it better? Or if things are, horrible right now and it's really impacting your emotions and your daily activities that, you don't have any motivation to continue life or even wake up tomorrow, then how do we help you get out from that state, state of mind? So it's about change too, and I think from my personal, and this is just my opinion, okay, personal opinion, therapy is for people who want to seek change. Okay, and I know maybe you might disagree with that, but that's fine, but it could also just be a place for people to come in, talk about the problems, and maybe they don't want to change anything. Maybe they just need a place to talk to somebody and not feel judged, or just for somebody to listen to their story. Because a lot of us have very interesting stories where we want people to listen, and these are more like stories about our experience, of course,
Our own struggles.
Yeah, our own struggles. But when we talk to people in our network, sometimes those in our network, they're not interested in listening to our story, and then it could do its toll on our mental health as well. So speaking with a therapist or counselor you know, maybe you're not looking for change, but you just need somebody to hear your story. And for a lot of folks, when they have the opportunity to share their story, it makes them feel a lot better about their current situation or about their story.
So, Chu, what kind of problems do people present when they come to therapy?
You know, it ranges from like a wide spectrum. You know, you can have things as simple as, you know, I'm not sure which school to pick. You know, college. It could be as simple as that. Well, when I say simple, it's simple in my mind, but to that client, it might be not that, you know, might not be as simple. Or it could be, you know, hey, I just lost my father or somebody I really care about, and you know, I just can't seem to live life now without that person. It could be very small or very big. It just depends, because problems are problems. You know, it's not just one problem. It could be anything and everything.
Mm-hmm. And it could be one person or a couple or a whole family.
That's right. And right, so, you know, when we do therapy with our clients, I mean, you and I, we both work with individuals and couples and families. So therapy is not just focused on one person. It can start off that way, and it could be the opposite too. We might start off with a family, and then one of the members want to just do an individual session. That can also happen, you know, because our behavior, and this is again my opinion, our behavior and our decisions impact those that are around us. So whatever we do in life, it affects somebody else. And I think they call it the ripple effect. I think that's what they call it.
Yeah. I think so.
Mm-hmm.
But aside from that, maybe us right now, we're not doing this specifically one, but there's also group therapy. So when you go and you discuss with people who have the same problems as you or the same struggles as you, you know, and it might not necessarily be anything to change or to make better, but just to have that peace of mind that you're not the only one, or that you know, other people are going through the same things that you are.
That's right. So there's many forms of mental health therapy or counseling. We talked about individual, family, couple, and even group therapy. And there's other terms for therapy too. There's the supportive counseling, that's part of it.
Psychology.
Yeah, there's a psychology type counseling where it's very focused on like a certain symptom or diagnosis that you have. For example, treatment for depression. I mean, I think that for those specific diagnoses and problems, it's very focused on depression, and it's not very family oriented at that point. But then again, it depends on the treatment plan as well, whatever the professional counselor decides to do, or with the client, then they can figure that out. But psychology counseling is different from, I'd say, family therapy. Would you say so?
Yeah, I think so.
But we all have the same goal, though.
Mm-hmm. Yeah.
The goal is to help the clients be in a better situation mentally and physically, hopefully. But the approach can be very different. We're not saying psychologists are bad or anything. We're not making any of those judgments.
Whatever fits you best would be the best option.